I am Samuel Kirchgessner, and I will be presenting the Evolution of Anesthesia, connecting history to the pacemaker. So, looking at the birth of anesthesia, the first public demonstration of ether as an anesthetic was performed by William T.G. Morton in 1846 at Massachusetts General Hospital. This allowed patients the first painless surgery, and some of these early anesthetics included ether, chloroform, and nitrous oxide. So, jumping ahead to the World War I era, anesthesia at this time was pretty risky. Facial injuries presented additional challenges for anesthesia administration. We read a couple examples in the book. Fitzharris mentions how one of the greatest challenges his team faced was the administration of anesthesia. Facial injuries often resulted in the obstruction of the airway, either from swelling of the tongue and throat or from the loss of muscles controlling the larynx. There's also some risks associated with the types of anesthesia they were using then. Specifically looking at chloroform anesthesia, military surgeons discovered in the early years of war that chloroform, a common anesthetic at the time, could cause ventricular fibrillation, a fatal cardiac arrhythmia. Now we look at modern anesthesia. There have been some key advancements made. Safer inhalation agents such as sevoflurane, development of intravenous drugs like propofol. There's also modern airway management tools. We see laryngeal mask airways and endotracheal tubes used often. And there are also monitoring systems for heart rate, oxygen levels, and brain activity. All of these advancements allow CRNAs and anesthesiologists to administer anesthesia safely and effectively. So, some key lessons in learning here. The evolution of anesthesia reflects progress in technology and patient safety. Challenges described in the pacemaker highlight the importance of a modern airway management system and vital signs monitoring. Nurses play key roles during the administration of anesthesia, providing necessary care to these patients. And here are my references.